Hello everyone. Myself, Dr. Shalja Singh, Assistant Professor, Conservative Dentistry and Endodontics. I am going to take a lecture on dental amalgam, metallurgy and manipulation. First of all, we will start it with the objective of my topic. The objective of this topic is to understand the composition of dental amalgam, including the role of individual metals in the process of amalgamation. Next is to explain the different type of amalgam alloy and describe the setting reactions. Third is this to discuss the physical and mechanical property of the amalgam. Next is outline the proper manipulation technique and also to emphasize the infection control measure and proper disposal technique for dental amalgam to ensure safe handling in the clinical practice. Introduction. Dental amalgam is an alloy by mixing mercury with the silver tin alloy. And according to Skinner, amalgam is a special type of alloy in which one of its constituent is the mercury. History. First used by Chinese. There is a mention of silver mercury paste by the Sukung 659 AD in the Chinese medicine. In 1833, Crawford brothers introduced amalgam to the US. In 1895, to overcome the expansion problem, G.V. Black developed a formula for modern amalgam alloy, in which 67% silver, 27% tin, 5% copper, and 1% zinc is there. Black's formula was well accepted and not much changed for nearly 60 years. In 1946, Skinner added copper to the amalgam alloy composition in a small amount. This served to increase the strength and decrease the flow. Traditional or conventional amalgam alloy predominate for 1900 to 1900. Now, the classification. Classification is number one based on the number of the alloy in the metal. Binary alloy, where the silver and tin are present, ternary alloy, where the silver, tin, and copper are present, and the quaternary alloy, where silver, tin, copper, and indium is present. Next classification is according to presence of zinc, zinc containing more than 0.01% or non-zinc containing less than 0.01%. Again, according to the shape of the powdered particle. First is spherical shape, smooth surface spheres are present in that. Number two, lathe cut, irregular, ranging from the spindle to shavings. And third is the combination of spherical and lathe cut, known as the admixed alloy. According to particle size, it can be micro, fine, or coarse cut. According to copper content of the powder, is it be low copper content alloy where less than 6% of copper is present, and the high copper content alloy where 6 to 30% copper is there. According to addition of noble metal, it can be edited with the platinum, gold, and palladium alloys. Now, the indication of amalgam is class 1 and class 2 cavity, moderate to large restoration as a core build-up material and can be used for cuspal restoration with the pins. Other indications of our amalgam are as a dye material, restoration that cannot be isolated in a teeth that act as an abutment for the removal appliances. Class 3, where the aesthetics are not so important, such as distal aspect of canine, especially if the preparation is extensive with the minimal facial involvements. And class 5, lesion is in non-aesthetic areas, especially when the access is limited and moisture control is difficult, and for area that are significantly deep gingivally. Contraindication of amalgam. Anterior teeth, where the aesthetic is a prime concern, aesthetically prominent area of a posterior teeth, small to moderate class 1 or class 2 that can be well isolated, and small class 4 restorations. Here some advantages of dental amalgam. It is easy to use, easy to manipulate, relatively inexpensive, excellent wear resistance. Restoration is completed within one sitting without requiring much chairside time. Well condensed and triturated amalgam has a good compressive strength. Here, some disadvantages also there in dental amalgam. Unnatural appearance, tarnish and corrosion, metallic taste and galvanic shock, discoloration of tooth structure, lack of chemical and mechanical adhesion to the tooth structure, mercury toxicity, promote plaque adhesions, delayed expansion, and weakness of tooth structure are also there. Now, the role of individual components. First of all, we'll start it with the silver. Silver is the main constituent of the dental amalgam alloy. It consists of two-thirds of the conventional amalgam alloy. It contributes strength of the finished amalgam restoration. It also decrease flow and creep of the amalgam. It increase the expansion on the setting and offer resistance to the tarnish. And also, for some extent, it regulates the setting time of the dental. The second largest component is tin. It combines with the mercury to form the gamma 2 phase, which is the weakest phase, and contribute to the failure of the amalgam restoration. It also reduces the expansion but at the same time decreases the strength of the amalgam. It increases the flow, it controls the reaction between the silver and the mercury, and tin also reduce both the rate of reaction and the expansion to the optimal values. Zinc. It acts as the scavenger of the foreign substance such as oxides. It also helps in decreasing the marginal failure. The most serious problem with the zinc is delayed expansion, because of which zinc-free alloy are preferred nowadays. Next important component is copper. It contributes mainly the hardness and the strength. It also tend to decrease the flow and increase the setting expansion. The next component is indium or palladium. They help to increase the plasticity and the resistance to the deformation. High copper amalgam alloy. To overcome the inferior property of the low copper amalgam alloy, such as shorter working time, more dimensional changes, difficult to finish, high residual mercury, high creep, low early strength, low fracture resistance, in 1963, high copper content amalgam alloy were introduced. They increased the copper content from earlier use 5 to 12%. Copper enriched alloy are of two types: admixed alloy powder and single composition alloy powder. Admixed alloy powder, also called as blended alloy, contain two parts by weight of conventional composition lathe cut particle plus one part of by weight of sphere of a silver copper eutectic alloys. The silver tin particle is usually formed by the lathe cut method, whereas silver copper particle is usually spherical in the shape. Single composition alloy, unicomposition. It is so called as it contains particles of same composition. Usually, spherical single composition alloy are used. ADA specification number 1 for amalgam lists following physical properties as a measure of quality of the amalgam. Number 1, creep, compressive strength, dimensional change, and modulus of elasticity. First property is strength. Compressive strength. Amalgam is strongest in the compression and weaker in the tension and shear. The prepared cavity design and manipulation should allow for the restoration to receive compression forces and minimum tension and shear forces. The compressive strength of satisfactory amalgam restoration should be at least 310 MPa. After compressive strength, tensile strength. Amalgam is much weaker in the tension. Tensile strength of the amalgam are only a fraction of their compressive strength. Cavity design should be constructed to reduce the tensile stresses resulting from the bite force. Next property is modulus of elasticity. High copper alloy tend to be stiffer than the low copper alloy. When rate of loading increases, value of approx 62 GPa has been obtained. Noob hardness number for this is 110 kilogram per millimeter square. Next property is dimensional change. When the mercury is combined with the amalgam, it undergoes three distinct dimensional changes. Stage 1, initial contraction occur for about 20 minutes after the beginning of the trituration. Contraction results as the alloy particle dissolve in the mercury. Contraction which occur in not greater than 4.5 microcentimeter. In stage 2, there is expansion. This occurred due to the formation and growth of the crystal matrix around the unconsumed alloy particle. In the stage 3, limited delayed contraction is there. Moisture contamination or delayed expansion. Certain zinc containing low copper or high copper amalgam alloy which get contaminated by the moisture during the manipulation result in delayed expansion or secondary expansion. It occurs 3 to 5 days after the insertion and continue for the month. Zinc react with the in which the zinc react with the water forming the zinc oxide and hydrogen gases. Complications that may result due to the delayed expansion are protrusion of the entire restoration out of the cavity, increased microleakage space around the restoration perforation, increased flow and creep, pulpal pressure pain. Such pain may be experienced 10 to 12 days after the insertion of the restoration. Next property is creep. Creep is a time-dependent plastic deformation. When the metal is placed under the stress, it will go under plastic deformation. The high copper alloy, as compared with the conventional silver tin alloy, usually tend to have lower creep values. Now, dental amalgam manipulation. Manipulation of amalgam, in which the first step is the selection of alloy, mercury alloy ratio, proportionality, trituration, mulling, condensation, carving, burnishing, and final finishing and polishing. Now, what is trituration? Trituration is process of mixing the amalgam alloy particle with the mercury. Originally, the alloy and the mercury are mixed and was triturated by hand with the mortar and pestle. Now, mechanical amalgamation save time and standardize the procedures. Objective of trituration is to achieve a workable mass of amalgam within the minimum time and to remove the oxide layer. Now, what is condensation? Condensation refers to the incremental placement of the amalgam into the prepared cavity and compression of each increment into the others. Amalgam should be condensed with the cavity within the 3 minutes after the trituration. The aim of condensation is to adapt the amalgam to the margin, wall, line angle of the cavity, minimize the void and layering between the increments within the amalgam. Restoration. Remove excess mercury to leave an optimal alloy mercury ratio. Condensation pressure load of 15 pound is recommended to be applied to each increment. Now, what is burnishing? Burnishing is divided into two parts. First burnishing, also known as pre-carve burnishing, carried out using a large burnisher for 15 to 30 seconds, using light force and move from the center of the restoration to outward to the margin. Objective of pre-carve burnishing is it is continuation of the condensation, also reduce the size and number of voids. It also remove the excess mercuries to the surface and adapt the amalgam further into the cavo surface anatomy. Carving. Using remaining enamel as a guide, carve gently from the enamel towards the center and recreate the lost anatomy of the tooth. Amalgam should be hard enough to offer the resistance to the carving instrument. A scraping or ringing sound will be heard. If the carving is started too soon, the amalgam will pull away from the margins. Now, what are the objective of carving? Objective of carvings are to produce a restoration with no overhangs, a restoration with the proper physiological contours, a restoration with the minimal flash, restoration with adequate compatible marginal ridges, a restoration with the proper size, location, extent, and interrelationship of the contact areas. Now, the second part of the burnishing is final burnishing, or also known as the post-car burnishing. Following carving, check the occlusion and may carry out a brief final burnishing. Use a large burnisher at the low load and burnish outward towards the margin. It improves the smoothness and heat generation should be avoided. Finishing and polishing of dental amalgam. Finishing can be defined as the process which continue the carving objective, remove flashes, overhangs, correct minimal enamel overhangs. Polishing is the process which create a corrosion resistance layer by removing scratches and irregularities from the surface. Can be done using descending grade abrasives such as rubber mounted stones or rubber cups. Now we will learn about dental mercury hygiene. Recommendation from the ADA include the following. The workplace should be well ventilated, use only pre-capsulated alloy, and select the appropriate alloy mercury ratio. And last not the least, use an amalgamator. Mercury and unset amalgam should not be touched by the bare hand. Floor coverings should be non-absorbent and easy to clean. Spilled mercury should be cleaned up using trap bottles, tape, or freshly mixed amalgam to be picked up by the pickup droplets. How to dispose the scrap amalgam? It, i- it can disposed by in a tightly closed container. Use radiographic fixer solution. Dispose contaminated item in a sealed bag. Do not dispose mercury contaminated item in a medical waste container or a bag or along with the waste that will be incinerated. Conclusion. There are certain advantages inherent with the amalgam, such as excellent wear resistance, less time consuming, less expensive, which are not present in the newer material. These factors will continue to make amalgam the material of choice for many more years to come. These are some references. Thank you for your attention.